Tell me a little bit about your experience at UMPT.
I definitely feel like I got a really good education. I have had physical therapy students since and can see the quality of what my education was in comparison to some of the other programs that are out there in different parts of the country, and feel very, very fortunate to have gone to I felt very well prepared for my career, and felt like I had a kind of a fostering of evidence-based medicine, and have continued to find that really important to keep up with journals and make sure that I'm really doing the most up-to-date things. I also feel like the professionalism and the cultural competence came through pretty strongly, to have a lot of the, whether it was ethical issues or just being able to deal with people and communicate the best way possible as well. And I'm just really glad in the selection of UMPT as far as my schooling.
That's good to hear, considering I'm in UMPT.
Yep, exactly, exactly.
What was your favorite class, or one of your favorite classes that you took when you were at UM?
Oh, I don't know. Because I'm just such an orthopedic kind of manual therapy person, I probably enjoyed a lot of the orthopedics stuff, whatever we call that, musculoskeletal, whatever it was called, that type of stuff. But I do, at the same time, I find it so important, all the medical aspects that we learned from the guest speakers in our other classes, just having such a knowledge base to draw upon for my patients, and being able to go, oh yeah, I remember learning about that, and having such a broad background and knowledge base. Those classes I think were very important. Even though I'm not in the hospital working, I still have to know what's going on. Pharmacology also I think was a really important course that almost in a way now drugs have changed over the past 8 years, so I just have to keep looking up things, but I really understand the classes of drugs, and so I think that was also really good. And I think, of course, the complementary therapies stuff is really important too, because we need to move in that direction of thinking of the body in a multifaceted way, not just muscles and bones, but also energy.
Okay. That's good to hear. Is there any other way you think that UMPT has helped your career?
I mean, I think just the framework that I just talked about is a big part of it, just the education itself has. I don't know if a name associated with that has anything to do with it. Probably not, especially when you move to other parts of the country. But it does seem like we always are connected. Like we can find each other of other grads and stuff. But I guess I just feel that I was very well prepared for a career in physical therapy, and feel like I really did have some of the best education available.